to approve the minutes of the previous meeting. Do you have any discussion? If not, we'll take a vote. All in favor say aye.
Aye.
Opposed, same sign. Motion carries to approve the minutes. Treasurer's report. No big changes, a little interest. Someone want to approve that treasurer's report?
Mr. Chairman, I'll move we approve the treasurer's report as presented.
Do we have a second?
Go ahead.
I'll second it. Motion has been made and seconded to approve the treasurer's report as presented. Any discussion on it?
What is the Board of Trustees reserve account?
What you're looking at?
Yeah,
What is it?
yeah.
Well, basically, it's existed since before my tenure here started, but most recently we use it as a depository from the funds we get on a regular basis from the local Masonic Lodge, which is can be used for any purpose, but basically because that particular fund is completely controlled by the board, it's called the Board Reserve Fund or account. And so, as opposed to some of the other discretionary funds, it's a place that was designated, I think, approximately a year ago to hold those Masonic Lodge funds, which are most of the deposits that go into it, I believe, about every other month. It's a small amount, but it's there to be used by the board at its discretion, is my understanding.
Thank you. Any other discussion? Take a vote. All in favor say aye. Approval.
Aye.
Opposed, same sign. No opposed.
Go ahead.
No opposition. Motion carries.
Sometime tonight we allow for a election or a nomination of a new treasurer.
I believe so. It's at the board's discretion to, technically I think we can do that under new business.
Yes.
Okay.
More toward the end of the meeting would be, I'm not an expert on Robert's Rules of Order, but I think that would be appropriate, don't you, Mr. Chairman?
I think under new business.
Okay.
And we shall do that.
And we need to elect a secretary too.
Medical staff report. Stephen, are you prepared?
Yes, I have a medical staff report. The medical staff will hold an organizational meeting tomorrow morning at 8 a.m. We will be going forward. So we will have a main meeting. Basically, what I have for you tonight is I have the credentials, recommendation from kind of our ad hoc medical staff committee. I have a recommendation for approval, the appointment to our medical staff for Yasmin C. Chima, M.D. Her specialty is pediatrics, going to the active staff, appointment with all requested privileges. I also have the privileges for Arshad Chima, M.D., primary specialty family practice, appointment to the active medical staff, appointment with all requested privileges has been approved by our acting chief of staff.
We
Steve, I just have a quick question while they're doing that. It's no big deal, it's just, I've been reading through your stuff. Is that the component unit? Is that the same thing,
I don't know what you're referring to.
right there under? Is that some nonprofit organization that helps fund the hospital? Is that the one what you just talked about?
Yes, that's Lincoln, no. Lincoln County Hospital Healthcare Foundation is a 501c3
Okay.
that
Is this-
basically does some funding for us.
The Healthcare Foundation, okay.
Right.
And that's a different group of people that helps fund you.
Yes, it's a different board, yes.
I see.
And they fund particular projects.
I see.
Alan's more familiar with it than I am.
Yeah, and I was just curious, I've been reading
Yeah.
through the stuff, what that is, and that helps. If you have an issue or something, you guys may fund that out of this foundation. Right. Okay, that's fine. I was just curious what it is. Mr. Chairman, I'll make a motion that we approve Jasmine C. Chima. Oh, well, it's not done yet. Sorry.
Go ahead.
No, I can't.
I'm not supposed to have that much power on my first night.
I thought you was done. Excuse me.
I'll pass it on.
Everybody else didn't got it. I'm sorry. See, it's always my, usually nothing where I make this motion. Next month, you can.
All right.
Okay, we got it? Mr. Chairman, I'll make a motion, we approve Jasmine C. Chima, in pediatrics, to the active staff, and Rashad P. Chima, in family practice to Lincoln County medical staff.
Rick,
I'll second the
You're my
motion.
second man.
I'll second the motion. You're good at it.
I'll be your designated motion
There we
secretary.
go.
Motion has been made and seconded to appoint the Dr. Shimas to the medical staff. Is there discussion on this? Then we'll vote on it. All in favor say aye.
Aye.
Opposed, same sign. Motion is carried. We'll appoint him.
I'm so glad you did that. I have an appointment with him on Thursday.
We'll make sure it's legal.
Yeah, let's do.
It will be. I have the authority under the law to grant them privileges, so they had temporary privileges
I
starting.
know, I was
last
joking,
Thursday.
I'm just glad the whole
Okay.
board
All right.
agreed.
But it's nice to have them fully credentialed by the board. The board has ultimate responsibility for that. Thank you, sir. Thank all of you.
My apologies to new members. Do you know everyone here?
I think so.
All right. Jim?
Don't know him.
Richard?
Richard Hansel.
Hanson?
Hansel.
Hansel.
That's my
Jim Weber.
Hello, sir. Nice to meet
Nice to meet you. Anybody else?
Very good. That was on my list for you too, so I just checked that one off.
Had a lot of things going here this morning. this
Yes.
evening.
Yep.
Okay, would you please continue with your,
Okay. We've introduced the new members. The Dr. Chima, Dr. Arshad Chima, finally got his license last Tuesday. He actually started seeing patients in the clinic on Thursday of last week, and have been relatively busy. One of the things that we agreed would transpire is the Dr. Chima will act as the clinic managers. So we kind of act, the three of us together. So we're still, we've already set up the appointment rules for the first go-round. We're setting up the, basically who's going to be where, when. So who's going to practice here on what days, what times, as well as in Silver Grove. So that's all going forward, I think, very nicely. We've also made sure they've been either have been introduced or will be introduced to the other providers in town. They've already visited with the Lincoln County Department. We're setting them up with the Lincoln Park Center home health people later this week, and hope to go down and visit with the people at the Lincoln Park Manor facility within the next week or so. In addition to those trips internally, I also took them to Hayes and Salina to meet the physicians and see the facilities in those two towns, because those are our primary referrals. And we've been acclimating them to a lot of things of that nature. So we got a lot of good feedback from both the physicians that made the visits, our Drs. Chima, as well as the physicians and the hospital people in both Hayes and Salina. So that'll be part of the relationship and the relationship building we're going to do from here on out. So I think that's all gone very well. There's still more work to do. If you don't already know, we have put out some flyers on this, where we're going to have a community reception for them on June 7th from 1 p.m. to 4 p.m. at the Finch Theater. And so we're inviting the public in general to that. Just anecdotally, there's a lot of excitement in the community for both of them, particularly from some of the younger women in the community who are pregnant, and because both doctors have been seeing patients right along. Arshad's been a little bit busier because the appointments we had yesterday, and the weather was so terrible that several of the pediatric patients didn't appear. So that was probably explainable by the cold and wet. But I think things are going to go ahead well. One of the things they both want to do, and we're kind of experimenting with the appointment schedule on that right now, as I mentioned earlier, is not only to do appointments, but to see walk-ins as well. So it's an attempt to see more patients in a more urgent way, because most doctors agree that they do want to see patients. That's what they're here to do. Yasmin Chima, pediatrician, will not have an inpatient practice. There's a pediatrics practice at the hospital in Salina as well as the one in Hayes. And because in pediatrics you have a lot of the physiology, it's a lot different, so it's better to have people who have worked with inpatient pediatrics, yeah. But she is taking pediatric patients from newborn to age 17. And then, as I've said, a lot of people are very happy that she's here. Dr. Arshad Chima is doing all of our inpatient work now. And so, again, he's getting acclimated to that. I think staff is very pleased with the interactions because both of the doctors, Chima, see one of their essential duties is not only interacting with patients in a helpful medical way, but also interacting with staff in a teaching kind of way. So I think that's off to a fairly good start. Check off a couple things here. A couple of the other things I want to talk about in your packet again this month, rather. You have a letter from the Kansas Healthcare Collaborative. That's the third letter we've gotten from them since October last year. Got one then in February and again this month. Again, commending our hospital as being one of the top quality of care hospitals in the state of Kansas. And so, as I am wont to do, I give credit to our nursing staff. But in addition to the nursing staff, I also want to compliment the rest of the clinical staff, support staff, for the care that they help provide to our patients. There are over 115 hospitals that participate in this program in Kansas, and we're in the top 20 of those from the best I can figure out. They're not doing the rankings anymore, but based on what we submit, what we're doing, I think our hospital is still doing very, very well. And so I'm quite proud and pleased of them. I go back and forth based on my notes and what I glance down and see at any one particular time. But I wanted to bring that up at the top of the meeting. I want to go back a minute to the clinic organization and going forward. Joe Black has resigned again from his position. I thought we had an agreement that would go through at least August, and he has been asked back out of that, and so I'm letting him. I am in the process of recruiting another mid-level to go into that position. And our plan with the Dr. Chima is to continue to operate that walk-in clinic. So between Jessica and Dr. Arshad Chima, we will be keeping that morning walk-in clinic open. That's been very popular even in the rainy season.
When is Mr. Black's last day?
Friday of this week.
Grief.
Steve, will Mr. Chima be doing rounds in the hospital?
Yes, sir. Yes, he's picked up the hospital practice. He is rounding on the acute care as well as the skilled swing bed patients. Yes.
Do either one of them are going to do? They don't do emergency room stuff, do they?
Well, Dr. Arshad Chima is available to consult in the emergency room, and on Thursday of last week he did consult on one patient.
Okay. I just didn't know if they were staying in the clinic or part of the other emergency office.
Well, it's only because he was rounding when this patient was in the emergency room.
Okay.
And he went over on his own, he wasn't called in. Part of the way we staff our emergency rooms, as we've discussed in the past, and this is on my list to discuss tonight, might as well go there now. We staff with mid-levels. They work 24-hour shifts. They work 8 of those 24-hour shifts per month. And so they give us pretty good coverage. They're all fairly local. I think the one who lives the furthest away is Lindsay Rutt, and she lives in Beloit. So, but they're here for their entire shifts. They take advantage of an internet and telemedicine service that we have through the Vera e-emergency, so that they can act at any time, 24 hours per day, can access a Kansas licensed emergency room physician who is a member of our medical staff.
Okay.
So they're licensed to practice medicine in the state of Kansas, and we have credentialed them. And so they provide some oversight. But Dr. Chima, now that he's going to be on full staff, will have ultimate responsibility for all of that.
Okay.
Now we do that, and I had some questions at last month's meeting about this. We do that to prevent disruption to the clinic and to keep from running off providers who primarily do clinic work. I know there was some discussion about the hospital in Ellsworth doing it differently than we do. And, you know, the people in the clinic can be on call to the emergency room, and then maybe on call that night as well. That can really be disruptive. If you get an emergency with somebody who's trying to see clinics and the patient, then that turns into something that might last fairly long. And these generally, you're doing a patient evaluation for an hour, maybe more, and then trying to get arranged for transfer if necessary, and so on and so forth. That means you generally that day have to cancel your clinic patients. If something happens in the middle of the night, the same thing. That provider generally will have them the next day off. That's built into most of those contracts. So that's why I changed the model here approximately 4 years ago. This hospital was kind of already on that model, but not quite. They had one foot in the stirrup and kind of had it mounted all up into the saddle and ready to go. So I had experience with Avera in the past. And contrary to popular belief, this is quite a popular way for rural hospitals to go. As you know, we are members of the Sunflower Health Network. It's an organization of critical access hospitals. There are now 26, maybe 27 members to that organization. Except for our sponsoring hospital, which is Salina Regional, they're all critical access hospitals, just as we are. So I polled 26 of the critical access hospitals to see what their ER staffing model was like. I got 13 responses out of that, which is 50%. And of those 13 responses, 10 are either starting to implement what we're doing here, what we pioneered here, or already doing it. That includes Ellsworth Hospital, for those of you who were here last month. Ellsworth is going to the model that we're proposing because they're burning out some of their younger providers. That's why they're also looking for a couple more physicians. But it includes a number of other hospitals do this the way we do. Concordia does it. Abilene does it that way. Belleville is in the process of implementing it. So if anybody wants to look at the survey, we basically, like we are in a lot of other things when it comes to quality of care, taking care of our patients, we're kind of in a leading position on that. And so after the comments at the last meeting, I wanted to make sure that everybody could understand why we use a VERA. It's for better patient care, and it's to prevent our providers from being burned out in the middle of their practice. So that's part of what we're doing, and I'm happy to go into more detail on that later if necessary, if anybody's got any questions.
No, that was a good explanation.
All right, thank you.
Thank you.
Thank you. I appreciate that. Couple of other things. We're getting ready to kick off the summer feeding program we do with the youngsters in the county, providing meals to children aged 1 to 18, free lunches and things of that nature. This will be the 4th year to do that. We're still the sponsor. This year we'll be feeding the children at the senior center here in Lincoln. And I think that's a great step forward. We've been doing that for several years in Sylvan Grove, and it's been very popular with everybody in Sylvan Grove. It's a good place because it's right across the street from the library, and it's just all centralized. We're hoping to have a similar success here. I know in talking to the people at the Lincoln Senior Center, we'll have an area that's separate from where the seniors meet, congregate, and eat, and they're looking forward to interacting with the children. Some of them do that. That's kind of why I'm glad we sponsored this, is because I like interacting with the children too, because my grandchildren are in western Arizona and Portland, Oregon, so it's kind of fun for me. But for the new board members, this is kind of one of the mission-oriented things I thought we should do. We're in the healthcare business, and I think when we look at that, we have a couple of responsibilities, and that's to try to improve the health of and the health care provided to the people we serve. And nutrition is an important part of that, especially in the youngsters. Lincoln County is eligible for this for a variety of reasons, but the primary reason is because in both of our school districts, we do this in Sylvan Grove because of the Sylvan Lucas School District, and here because of Lincoln. In both of these communities, close to 55-56% of the children are eligible for either free or reduced price meals. Now, the children that get free meals, they make up 40% of the population of both of those school districts. So we're trying to maintain some what's called nutrition security, things of that nature for these children. Make sure we know they get a meal or two every day they're in school in the fall and the spring, and this is to get at least one meal per day in the summer. And so we'll start our program on June 3rd and run it through August 2nd. And the only day we won't provide a meal will be the 4th of July. And we not only provide those meals, but we also, in cooperation with our partners at the Lincoln County Health Department, provide a snack at the Lincoln Municipal Pool between 3:30 and 4 o'clock every weekday. I'm not sure on that time, don't quote me on that, but it's pretty close to that time. So that's one of the things we do. And there are other people that are interested in the community in making sure this works, working with the churches. But one of the things you have to do, because this is a USDA program, just like the senior centers or USDA programs, is that the sponsoring facility has to have a 3-compartment sink. And we have a 3-compartment sink. The only other ones are at the 2 schools, and the schools close down in the summer. And they don't do it. So I think it's something good we do with our school partners. The other thing we do, again, for our new board members, is we also pay for and help facilitate the concussion management programs of both of these schools. And so that's been an important part of our program, too. That's where we first started getting involved as partners with our school districts. in this county, both of them, because we do that for both. One of the surprising things that comes out of this, and I don't know any names, but I think we actually get more concussions from girls basketball than we do from football. And those ladies are awfully competitive. Just staying in that vein, the other thing that we do, because we just finished this up in the last couple of weeks, we do all the school sports physicals. And we do those for a very discounted price. And because we have so many low-income families, Lincoln County is not only a frontier county where we have only 6 people per square mile, we're also an underserved county for a low-income population. And so what we've done in working with school districts is we pre-identify the children who may not be able to afford even the $15 sports physical, and make sure that they get a physical without anyone else knowing that they're getting a free physical. So those are some of our what I would call community health related. You've heard of the population health movement, the community population health movement. That is part of, again, what I consider part of our mission to the overall community. So we're very active in doing that.
I have a question for you.
Sure.
On the lunch program, did
Yeah.
that start out as a grant that the school district got?
No, that did not.
Okay.
No.
My brain's someplace else then.
Yeah, I think they've got grants to support a couple of special programs, Jill, but this basically came out of a meeting between Kathy Robertson, LaDonna Reinert, and myself. We have a group that meets on a somewhat irregular basis called the Live Healthy Lincoln County group, and we have our website. It came out of some of the early meetings we had at that group.
Okay.
Because that's something that public health and the schools both wanted to do, and it was just something that we were the best positioned to actually accomplish.
So, so if I'm going to go into detailed explanation about this, the funding comes from you?
No,
or
the
USDA?
funding comes through the USDA.
Okay.
We do all the administration of the program.
Okay, gotcha.
The USDA funnels this basically through the Kansas State Department of Education.
Okay, maybe
And-
that's what I
and-
got.
And they
Okay.
manage, that's who I do all the paperwork for.
Okay.
So
I follow you now.
That's separate from WIC? Like WIC?
Yes.
That's a different
Yeah,
deal.
yeah,
Okay.
WIC is women, infants, and children.
That's a different-
All-
okay.
Yeah, and that's administered by the Lincoln County Health Department.
Or like the SNAP.
SNAP is food stamps.
Food stamps,
and
that
I'm
has
not
nothing to do with
sure.
this. Well, that's a USDA program funded too, but it's different.
Well, USDA has one of the largest budgets in the country, and almost all of it goes to SNAP, WIC, and programs like that.
Right, food stamps and stuff.
Yeah.
But you're not part of that here. You're
No, our program, again, is administered through the State Department of
Okay.
Education.
All right.
So that's who I'm
Okay.
responsible for all that. So we're going from there. Otherwise, interior to the organization, again, getting back to what's going on in the hospital, we're getting ready to do performance evaluations. We budgeted raises from 0 to 3.5% this year. So I'll have department head meetings on Thursday, and we'll talk about this. Performance evaluations will have to be done by the end of June, unless I have a real rebellion on my hands. So then I might make it the end of July. But everybody wants raises, but they've got to be tied to performance evaluation. And again, that was something that, together with the budget that we do every year, was something that the board asked me to do when they brought me on to develop a performance evaluation system and organize one, and also with Tanya's capable help, develop the budget. And speaking of the budget, there's been some stuff on the internet about the budget going to the county commission and things of that nature. since I've been here, and I think going back much further than that, based on the people I've talked to, every year we have sent a budget to the county commission, but it's always been addressed to the public building commission because it's the same thing. And it was one of the requirements of our bond covenants that we do that. So we've been doing that for at least however long we've been working with the PBC on those bonds. So because of all the kerfuffle on the internet, we went ahead and made sure we submitted a separate budget this year already, addressed to the Board of County Commissioners as the Board of County Commissioners. So that has been submitted to the county. In checking with my compatriots, the other county hospitals in northwest Kansas, again, those 26 hospitals, the ones that are county hospitals, that is all they do is submit that budget as a courtesy to their county commissioners and then go forward without any further checks or balances. So I wanted to make that comment because I know there have been some controversy and people have asked me about that. So we will be going forward on that. I have another Kansas Open Records Act request on my desk. I'm working with Dick Hay, our attorney in Topeka, on compliance with that. And I'm still waiting for a request. I submitted that a little over a week ago. I also know that similar requests are going to a number of the Sunflower Health Network hospitals in the area. I know I've gotten calls from some of the CEOs asking me what's going on with it and why are they getting these forward requests. But I wanted to let the board know we're in the process of seeing what we can do to comply with those. The other thing that I'm working on and that we discussed at the last board meeting is I distributed to all of you, I believe, copies of the updated bylaws, both the paper version and to those of you who had email version to read through. And I'm wondering, are there any comments on that?
I was hoping we could act on it tonight. I was going to bring it up in the old business.
And that's fine. I just, but prior to that, I thought it incumbent on me was to ask if anybody had anything, any comments or concerns to address. And I don't mean to jump towards actual action, but just to have that out. Okay, so that sounds good to me. The other thing we've been working on and that we have are back and in pretty much formal language, ready to go. I think they're ready for us to go. Are the Lincoln County Hospital compliance plan, both the code of conduct and the actual compliance plan. Like a lot of the other programs that we work with through the federal government, compliance, HIPAA, some of our privacy things of that nature, we work with a larger set of partners. For us to do this on our own would be prohibitively expensive to administer, because under this compliance program you actually have to have an 800 number. If somebody who works here thinks I'm a crook, they can call without my knowledge and report this and so on and so forth. So we work with an organization I think some of you are familiar with called the Great Plains Health Alliance. And even though we work with them as a participant, they have hospitals that they lease and manage, but they also work with hospitals like ours to help build these administrative programs. And so this has gone through their lawyers, their review process, and everything of that nature, and it's good to go. This board doesn't have to take any action on it. You can acknowledge that we are in receipt of it, which will be in the minutes, but that's where we're going. When you sign your annual, what's the agreement? Confidentiality. They wrote that as well, the confidentiality and compliance agreement that Mr. Crankle, you signed earlier today, and Mr. Weber, you signed as well. So that's all part and parcel. We've been talking to you about this for a couple of months, but this is now finalized and up to date and ready to be administered. It saves us a lot of money to work cooperatively with our partner hospitals in this and do that. So that will be that going forward.
Excuse me. Are we current on our confidentiality reports now?
Lorelei, we would brought one for Lorelei to sign tonight, but Lorelei is having hip replacement surgery tomorrow and was unable to make the meeting tonight. But yes, that's the only one we have outstanding that I'm aware of. The only other thing I would bring up, and we can do this again at the end of the meeting under the other part of new business, and I think I mentioned this in my memo to you. We'll be doing a review of our quality improvement, quality assurance. It's a quarterly thing we do with board plans, plus a risk management plan, which will have to be in an executive session because of the confidentiality parts of that. Somewhat last and less formal. In the past, when a board member has left the board, a trustee has left the board, we've done a plaque. And so I'm wondering if you think that's still appropriately, and I think you helped us with that when Mitch left.
Yes, I did. I went somewhere and had somebody in the back alley hammer one out.
But
I have to go over what,
yeah, let's sit down and talk about that. I just put it on the list so I wouldn't forget. But I know, I have it written down somewhere. Galen had 14 years on the board, and I think Jack had approximately 6. So both fairly long-serving gentlemen.
okay.
All right. And unless there are questions, that pretty much sums up my report today.
I have a question. On the meals that we provide for the kids, does the school district help with that in summertime?
No, we do all that.
Have they been asked about that or not?
Yes, we've worked with the school district until this year. The first 2 years that we did the feeding program here in Lincoln, we basically did it for 2 years at their administrative office downtown. And we stopped feeding there when they turned their old boardroom into a T-shirt shop. That's not what they call it, the paw print or something of that nature. And then we worked with them at Lincoln Elementary School, which worked very well. But this year, Lincoln Elementary School is basically going under some remodeling and renovation. I know one of the big things is they're installing all new HVAC systems, and they didn't want the children around this year because they were afraid of construction accidents, things of that nature.
Gotcha.
And so that's why we went to the senior center. But yeah, if it had been anything else, we probably could have done it. There are several places, a couple other places that were interested. I talked to the library and the people who run the Cube. when it came right down to it, I think all of the principals in this, between the hospital, the health department, and the school district, thought it's an excellent opportunity to mix two generations together at that senior center. I think it's good for the kids. And
That's a good deal.
Yep. So I have to say, yes, they've been a good partner with us since I got here, and so we partner on a number of things.
So is that to be happening next summer then maybe?
We'll have to see. We'll have to. I have such we've always wanted to do it at the senior center.
Right.
And if everything goes well there,
Yeah.
if the seniors are happy with it and we don't have any incidents or disputes or things of that nature, I just soon leave it at the senior center
Right.
and go from there.
Yeah, I wasn't worried about moving it or anything. It just, we're taking the whole ball of wax this summer on this, where we had help last summer, right?
Well, yes, but I need volunteers kind of to run the operation there, and so I'm using a couple of their summer interns to actually help run that. A young man by the name of Preston Howard is going to oversee that. He'll have a couple of other helpers as well, which is also one of the new trends in this, is that you use some of your upperclassmen from the junior, senior high school to help with the kids that are generally much younger than them, but young enough that there's still a bit of rapport there. Yeah, it's still good. We're still good with the school district and everybody else.
One comment for future bureaucrats: the compliance program document is not dated.
I thought it said May 2019 on the bottom.
That's the code of conduct, I think.
I think both of them.
Yeah, they're
Yes,
both
it
dated.
says, yeah, last updated May 2019
Oh, okay.
on both.
The signature revised. The signature page did not have.
Oh, okay. We will advise Great Plains Health Alliance of that.
Any other comments or questions?
You want to get the proper wording on that before we approve it then tonight?
What's that?
Date that Bob brought up on that signature page.
Is it, I don't know what the legal question is that,
It's not a legal issue, it's a bureaucratic issue.
Okay.
There'll be a task force appointed in the year
Oh,
2027.
all right, okay. No, I understand that. We've been caught on that before, trust me. We've been surveyed by some of, but we will go ahead and contact Great Plains Health Alliance and see if we can get a signature page with the date on it. So thank you for that. We will do that. And again, as I said earlier, it doesn't explicitly require the board's consent, but we will make sure that bureaucratic error is fixed.
If not, we'll move on to old business. Helen, I believe you had something?
Well, I'm just gonna see where we's at on the bylaws, if the board had all read up yet, or with the new members, do they wanna take another month to read them?
Yeah.
You do.
I had something here I was thought about proposing for an addition to, but I can't find it. I know I read it this afternoon somewhere, so, anyway, that's all I got on that subject.
I have something I think would be under old business. Got your current income in the budget and the prior year's income on these pages. I was wondering, when does your fiscal year start?
April 1st.
That's why these all look funny.
Yeah. That's the key part.
Because they're the monthly, the single monthly income and the expense is the same as the yearly. And I go, no.
Yeah.
That's why I had to find out when you started.
Right.
And that's the only thing I could come up with, that that's when it actually started.
Fiscal
I'm
years.
just
And
clarifying it for me.
And, you know, a lot of places are on January 1, December 31,
Right.
but most of us as critical access hospitals, once we get that critical access hospital designation, we pick the first of the month as the next closest month to be our fiscal year
Gotcha.
end and date time, primarily just because of the way we're paid. And I don't want to put you to sleep right now, trying to talk about how cost reimbursement works for critical access hospitals. But it all ties into, you know, we send out our, we get audited every year. And so we have to fill out what's called a cost report, which is our audit is basically generally accepted government accounting principles. And but the cost report that drops from that our accountants do for us goes to our intermediary, and then they look at our allowable expenses and decide, you know, whether to raise our reimbursement, or they'll either raise our reimbursement because they've underpaid us, which is generally the case, or if they've overpaid us, then we owe them back. But it's when Eric comes here in August, you can ask him all about it. It's all magic.
That's why I remember that.
Magic with numbers.
Make a note.
Yeah.
James, if you go to page 4 of the bylaws, you'll see in section 3 under the budget, it says there's the April 1st through March 31st.
Well, I didn't have that information when I was looking at it.
Yeah, he just got his copy of the bylaws tonight. That's kind of,
That's all right.
I didn't think.
That's all right. It just clarified for me. Then everybody else understood.
Yeah. No, we're here to help. We want you to be a successful trustee on our board.
Mr. Chairman, can I back up my comment about the bylaws? I found in section, middle, page 4 of the proposal says require each member to sign a confidentiality statement annual. I think something that should be added to that, in other sense, is that no board member shall be able to go into executive session without having signed that.
Say it again.
I don't think any board member should be able to go into executive session without having signed this confidentiality agreement. I'm no attorney, but I just feel that would be proper.
Don't you go into executive session sometimes with people that aren't trustees to your board?
So they do.
Well, then they're not, wouldn't be in a confidentiality agreement, so.
Yes, we do. We all sign. We all sign non-disclosure.
But when
confidentiality.
when some other third-party person comes in, that you would have to deal with. You would never have that happen?
Well, you would have to give them a special.
Okay, so I'm just curious.
Okay.
Like, say, for a commissioner, we may, I don't know if there's ever a situation where you'd have to be in an executive session with you guys, but I
Have to
don't
issue
have.
a subpoena, I think.
What?
Have to issue a subpoena.
Subpoena for me. Well, we might have you in executive session up there.
Maybe your,
And then you won't need a confidentiality agreement with us.
maybe your confidentiality agreement you sign as a commissioner would work here.
Right.
Yeah, maybe so. See, I don't, yeah, that's a good point. I don't know.
Because
I'm just curious. In other words, normally you guys would only have trustees or employees go in executive session. So you all have done a confidentiality agreement, so there's never an issue, bottom line, right? Yeah, that's fine.
I'll run that by Mr. Hay.
Thank you.
Okay. Any other old business to be discussed?
Is this old business or new business?
That can be current business if you want to. But it could be in their new business too.
So we're right in the middle.
It's in the middle.
This is for the month of April, I'm guessing.
This is as of today.
It's for the month of May.
No, it's just as of today, board meeting day.
Oh, this is balance sheet then.
Well, it's cash on hand.
Bob, what is your question?
What do we do with this that was just handed out?
That was a report that was copy requested by the board that we regularly show them cash on hand. Total
It does
cash
not
on
require
hand.
action.
Yeah, it's just information on it.
Okay, good.
Thank you.
Yep.
Once again, that was common knowledge on the full board members and not thought as something that needed an explanation now. Probably a remiss on our part. If there is no other old business, then we'll move on to new business. Approve the accounts payable. I'll enter the motion that we pay the accounts in the amount of $580,125.45. May I have a second?
Second.
Motion has been made and seconded to approve accounts payable. Is there discussion? Questions on the accounts payable? None?
Just,
Then I'll ask for a vote. All in favor say aye.
aye.
Opposed, same sign. Motion passes. We have new business to conduct tonight's special election for the missing two members that have left us with open chairs. Election of a treasurer and secretary. May I have nominations from the board?
Can we do it all in one motion?
Let's do it all in one motion then.
Without asking him, I'm going to nominate Rod Broberg in the position of secretary and Richard Ansel in the position of treasurer.
I'll second that.
Thank you, Bob. Motion has been made to elect Mr. Broberg secretary and Richard Ansel as treasurer. Is there a commentary or protest from the appointees?
I like that. After you hear the long train running.
Then I'll ask for a vote. All in favor say aye, and I'll have to see a show of hands on this one. Opposed? Motion carried. Congratulations to our new secretary and our new treasurer.
I'll I'll have to ask you after the meeting just what exactly is it that I do.
You provide this piece of paper.
That's what I thought.
You go by the bank, test it, and ask them for this.
Okay.
I think we got,
And bring it to Tanya and I.
then we got to provide a copy of the minutes, they unapproved, before they accept it, yeah. Mr. Chairman, since Mr. Leggett has resigned, he was on the building committee with me. I'd like for you to appoint Mr. Broberg to fill that position.
Chair addresses Mr. Broberg. Do you all oppose that?
No, that's fine.
Then so be.
You want to do Mr. Siegel, or do you have
We're ready to do that, yeah. Risk management.
We'll be at, well, let's do that absolutely last. QI, QA, risk management.
Yes.
And just so Mr. Sickle can go home if he wants to.
Yes.
Mr. Chairman, I have a couple comments.
Oh,
Go ahead.
I was approached by a person in the community that she was appreciated that Barb Hollis in radiology sent her a reminder note telling her of her upcoming mammogram, and she thought that was very thoughtful of the hospital to do something. I also had a lady call me today who had seen Dr. Chima. She was excited that we have a new doctor here. She thought he was very professional and polite, and he had a white jacket on. The only other thing I got, the foundation has received some memorial money in memory of Gene Markley. So that's
So noted.
okay. Thank you.
The board, we have a visitor here to address an issue. Mr. Siegel?
I'm Mr. Siegel, and I'm a resident of Sylvan Grove. And the reason I'm here is I'm really trying to help the hospital as much as I can and make sure that our communities are safe for all residents. As you well know, last winter was pretty tough around here. Fortunately, my wife and I snowbird. We spent the winter in Florida, and every morning we'd get up, look at the weather on internet and say, wow, we're sure glad we're in Florida, because it was cold and icy back here. Which brings me to the point. Just before we left for Florida, my wife had to go to the emergency room down here. And the reason for that, she slipped and fell in our driveway, hit the back of her head, and it was bleeding and a great big huge goose egg on it. And I brought her down here to the hospital emergency room, and they did a marvelous job. I really commend everybody here at the hospital for the work that they did. And fortunately, she did not have a concussion, and so we went back home and everything. But within a few days, she had to go back into the clinic to be examined again. On that particular day, we went in there, and I don't know how many of you are familiar with the Sylvan Clinic. Probably most of you are. And they did a pretty nice job of building that place, except the contractor or somebody really screwed up on the parking lot at that location. The drainage is absolutely terrible. During the summer, like right now, it's a pond. And I've got a photograph on my phone if you'd like to see it in the pond configuration. However, during the wintertime, it is solid ice. And I never forget the day that my wife went to the clinic there. I think it was probably around December 3rd. Abby, who saw her, actually walked my wife to the car because of all of the ice. in that parking lot. It's terrible. Something needs to be done with that. On December 4th, I called Steve, notified him of the situation, and I basically said, something needs to be done. And if it's not done, I'll be honest that you may be looking for a lawsuit on down the road. Because if somebody falls there, it's not going to be nice. I went ahead and did my snowbird trip. When I got back on, I think it's April the 26th, again, I called Steve to simply get the status on that. And he informed me at that point in time, I believe, Steve, you said that you had already done the estimated budgeting of what it would take in-house, and that you was putting this out for bid with a contractor or something.
Well, we're looking for a contractor.
You're
I
looking-
wouldn't say we're putting it out to bid per se.
Okay.
We're looking for somebody local who can find the time to do it.
Okay, and have you found anybody? What's the status of that?
Well, basically, and I've talked with Steve Ladd, who does our plant operations and maintenance,
Okay.
and we know how much concrete we need, because we're not only going to try to fix that parking lot in
Right.
some way, shape, or form. We also need to fix the sidewalk that runs along in front of it. So we know how much concrete we need. We just need to find somebody who will do it. Steve has talked to 2 or 3 people, but there's nobody. They're so far behind in their jobs now that they're probably not going to get to it until later this summer when things dry up substantially, because it has been so wet.
Yeah, it has to be.
And it's just the availability of the help in this area, because we like to keep as much of that local as possible.
Understand.
And then the weather. So we are addressing it. Steve's done the preliminary calculations on the concrete, things of that nature. So we're ready to go as soon as somebody has got the time, makes the time to do the job.
Well, I guess I understand where you're at there. My only desire and hope is that the work is accomplished before the ice forms next winter.
That's our desire and hope as well, sir.
And
Well, I'm hoping by the time it dries up in maybe July or August.
I'm not a contract person. I'm not a concrete person. I got 2 brothers at work.
Yeah.
But if there's anything I can do to help you on that, I would certainly volunteer for it.
Okay. All right. Thank you.
But there is one thing you can help us with.
Sure.
Relocate that house immediately to the west.
From what I've heard is, I think the city of Sylvan Grove has that on their list of, they've taken it off?
Okay, so
And that is currently owned, I think, by the hospital. Is that correct? Well, you're sort of in a situation similar to myself.
I'm gonna put it back in the hole.
I have what I refer to as an old chicken coop in the back of my house that I would just as soon have somebody take and get rid of it and everything. I put it on the list of buildings to be demolished in Sylvan Grove, and I was informed that I couldn't do that because it was not a residence. Well, I'm thinking about getting some hammocks put down there for the grandkids and say, well, we've got people living here.
well, the mayor told maybe me, I don't know if he told Steve that they had to have 3 houses fixed up before they can tear one.
Yes, that's
Yeah.
what
That's
they
exactly what they told us.
that's what I've heard as
Well, I
well.
thought if you could help us out.
Now, you know how long that's going to take? That
We should live so long.
I just had to teach
I'll
you.
lay you a bet. I bet the parking lot gets fixed before that occurs.
Maybe not. Maybe lightning will strike. You never know. I just thought that.
Anyway, and one other, Steve, I don't want to take your thunder here, but the other item that I will mention, and Steve has some photographs of it, and I actually have the items in my cart as a sample. My wife and I, well, let's put it the other way. My wife purchased some Norman Rockwell paintings total of about, I think it's 8 of them. I think there's 4 of each.
Yes.
She did this on a cruise at an auction. She thought she was getting a good deal. And then we had a nice home in California that would support those paintings. So we had those professionally framed and everything. They're very, very nice Norman Rockwell paintings. And they're not doing us any good right now because we've got a small house in Sylvan Grove. We would like to see them put to use someplace by somebody that would really appreciate it. Walking down the halls of the hospital the other day, we looked and it's just pure vacant walls. And we would like to, if you want, to donate those to the hospital for your use here, if you can use them. And it would be your decision whether or not you want them. So I'll throw that out.
Thank you.
With that, if you'd like to see those pictures, I got them in the car. So
Take our word for it. Yeah.
thank you very much.
Thank you.
Mr. Siegel.
Mr. Second, it was good to see you.
I was going to go get Nancy from the QIQA and then,
Then we'll go to executive session.
yeah, after she's done with that.
Okay.
Should we act on that? Should we act on his generosity?
Mr. Chairman, in breaking with tradition, I would move that the board graciously accept Mr. Siegel's offer of the Norman Rockwell paintings to be utilized in decoration of the hospital. Unfortunately, I
second on that
cannot
motion?
second my own motion.
I'll second it. Take the load off his shoulders.
Any discussion on this matter? We'll take a vote on that. All in favor, say aye. Opposed, same sign. Motion carries. It's a done deal. Thank you for the motion.
Good idea. Good idea.
Well, they are blank
They
walls.
are.
Hospitals are dreary as they are. In the best of times.
So we have a seat
Okay.
over on that end if you wish.
Either one, whichever you.
I'll sit by you.
All right.
We haven't voted on this yet. How many minutes will this take?
Oh, probably 10.
This is,
Well,
this is not executive session.
It's not?
Yeah, the first part for the QI
Okay.
needs to be an open session. The risk management is back to the session.
Okay, does everybody have a copy of the quarterly report on quality assurance? Does anybody need a copy? All right. Products just, okay.
Quarterly report on,
You got that? Okay, good deal. All right, just a few of we had quality reports turned in from January to March 2019. Housekeeping, they are changing filters as soon as the patients leave so that the dust and spores are being contained. They've also ordered larger biohazard containers that hold more so that the housekeeping staff don't have to lift anything. They had a problem with mold at the clinic. It's under control. It was painted with anti-mold paint, and housekeeping sprays vinegar water weekly, and it's slowed down the spores considerably. Physical therapy cleaning has improved because they used to have to schedule it every 6 months when Steve or Eric were available to help move equipment. However, we added Randy to our staff, and he's able to move the equipment, so that puts them on a better every 6 month schedule. With pharmacy, our oral medications unaccounted for, the threshold was less than 1%, which meets our goal. And the injectable meds unaccounted for was less than 1%, and that also meets our standards. 100% of all emergency room take-home beds were logged out. Infection control, we had one hospital-acquired infection reported between July and December 2019. 4 patients required isolation.
Excuse me, do you mean 2018?
Oh, yes, I do. That's a typo. I'm sorry. Yeah, it's not December 2019 yet. We had 4 patients that required isolation carts between July and December 2018, and we were 100% compliant with that. There were no bloodborne pathogen exposures, and we did an annual employee TB risk assessment, and we were 95% compliance with people completing that risk assessment. During the influenza season, we had 42 patients admitted, 12 patients received the influenza vaccination here, 13 had already received it prior to hospitalization. 11 patients signed declinations refusing the vaccination, and 5 patients were missing data, so we were 88% compliant there. We're going to be looking into tracking hand hygiene. We're going to be looking into being a part of a statewide hand hygiene tracking as soon as Krista and I get in on the webinars and everything. The nursing department, Avera daily camera checks, we were 99% compliant. Adult and pediatric crash cart checks were 97% compliant. Let's see. The drawers, when the lock is broken, they were 94% compliant and going ahead and replacing that lock on drawer 1 and 90% from drawers 2 to 6.
Why is drawer 1 different from drawers 2 to 6?
Well, I'm not really sure why. They just must have opened the drawer 2 through 6 more often. And drawer 1 has our medications, so it doesn't really get used as often. Let's see, daily log tag checks where they go in and check to make sure they were, again, 94% on drawer 1 and 90% on drawer 2 through 6. It could have been that somebody forgot to sign on those lines and they might have done it. I'd have to do a little more research into that. Nurse documentation, 21 charts were reviewed randomly by the Director of Nursing. Consents were signed on 90% of them. Medication reconciliation was done on 85% of them. Pain management documentation, when a patient is on pain meds, was 100%. Pain medication follow-up after the medication given was 100%. And patient education documents were provided 71% of the time. On our Falling Star program, we were 100% compliant. There were no falls documented. And emergency department documentation, we had 380 charts reviewed. Provider in and out times are checked. 99% of the time there was a time for provider in, and 96% there was a time for provider out. Nursing signatures on all signature lines was 97%, and all other areas were 100% compliant. On our cardiac monitors, our auto pulse daily battery swap was 97% compliant, and the daily checklist on the auto pulse was 97%. On blood transfusion reviews, of the 5 charts audited, the accuracy check was partially documented on 2, but all other 5 checks were 100% complete. Objective met on scanning medication. We were 40 to 50% compliant. Our goal is 10%, so we're doing quite a bit better than our goal. ACLS and PALS certification. We have 1 nurse that still needs to take PALS. Everybody else is certified.
Can you tell me what PALS means?
Pediatric Advanced Life Support. On the medical staff, the physician assessment and certification forms being filled out for transfers. All of our EMTALA forms were 100% compliant, as well as medical records being sent. And history and physicals being sent with a patient or faxed in 60 minutes. Kind of needs improvement, but we've made changes to the EMTALA form, and that is improved greatly from that. Health information, medical records. They keep track of if papers, admission papers are signed. And on observation, acute, swing bed, and ER, we had no times and dates on signature pages on 42 out of 354 total, which was 88% compliance. We had 98.6 compliance on the witness signature, which is somebody has to witness their signature. And on 5 of those, there was no witness signature. On ER paperwork, we had 5 out of 278 that no consent form was signed. On our acute admissions, there's a second signature that goes on a message from Medicare, and we had 4 out of 135 that were not signed. There's also a special form for observation, and out of 16, 1 was not signed.
What does MOVE stand for?
Oh gosh.
I'm sorry, what was the question?
The moon form.
An acronym.
Yeah.
That got me.
Some government.
Yeah, I haven't worked the floor for so long, I can't remember what that does stand for.
Question on it.
Okay, I will get that information to you. And then on acute admissions, there was 1 out of 35 message from Medicare that was not signed.
Excuse me, what happens to those when you don't get the signature on?
Well, medical records give me a list, and I cancel the people who are not signing the papers. I give them a notice that tells them that they...
Medicare outpatient observation notice.
Okay. Medicare outpatient observation notice is what
You
notice
Googled
means.
that, didn't you?
Thank you. Basically, I know what the form actually means is that if by chance Medicare or any other insurance company doesn't pay for that, it just shows, it just is the patient's acknowledging that they're responsible for payment. I know what it's for, I just didn't know what the acronym stood for. But to answer your question, medical records gives me a form showing the ones that are not signed, and then I talk to the nurses or the nursing staff and give them a note that says that they didn't sign that.
But then ultimately they do sign it, right? I mean, take them back and have them sign it.
I don't think they do they?
No, this is just a quality check that we do.
Yeah,
We always
it's just-
counsel the people. But yeah, a lot of these will go through without signatures. But what we're trying to do is just reduce the error rate.
Right.
And it doesn't really affect the outcome, but, it's just like I like to say it's just like being in the military because somebody else is looking at your work. They're looking at that rifle barrel as to whether it's clean or not. And if it's not, you're going to get it over to clean again. We use a little less harsh. It's more educational than actually disciplinary. But we do track this.
And then when a provider admits a patient, they are required to do a history and physical on them within 24 hours. And the current performance is 100% up from 6 months prior, which was 87%. So we've really improved that. The 2 midnight benchmark statement on Medicare admissions, which is another form that the providers are supposed to be filling out. The current 6 month period was 70%, and the prior 6 month period was 76%. That was pretty much due to one provider just not really understanding, I guess, what.
Well, we just, as you recall, our education on that was discussed with medical staff.
Yes, medical staff.
The things of that nature get brought to my attention when a provider is not. You have to go back to the regulation set that we work under. A provider has to make at the time of admission several different decisions. Are you going to admit them just for observation, which can last up to 48 hours or 2 midnights, okay? Or he can admit, which is one of the places that they want to see that, or to an acute care admission where the provider has to say, this patient needs to be in acute care for at least 48 hours or 2 midnights. Then it will, they have to attest to that. And then we don't have to scramble as hard to get paid from Medicare and some of the other providers because of those attestations. But they have to make that decision right at that time, that this will require hospitalization of more than 2 midnights, and then once they've been in the 2 midnights after the 3rd day, we can put them in skilled beds. And observations then after the 2 midnights, you can generally make a decision, which is generally to send them home, because by then they're not going to require the 3-day acute care stay. But those are all things that providers have to do and declare at the time of admission. And they have to have a reason for that decision, and they've got to write that down, things of that nature. But we did go back and discuss that at our, I believe it was our March
Yeah, it was just here recently.
medical staff meeting. It was very recent.
Okay, radiology was 100% compliant in all the areas that they're tracking. Laboratory has come up with some new QA/QI. So quarterly, the state requires 5 tests in 4 different areas to be retested for accuracy. And so the criteria checklist will be reviewed quarterly, and all records kept for at least 2 years. And basically what they explained to me is they're just going to pick 5 tests that they've done on patients at random and retest them to make sure they come up with the same results. And then all of
And the way they can do that is that, because of these kinds of testing requirements, we sometimes keep blood and urine samples for several months in either a frozen or refrigerated state so that we can retest and do that. And this is in addition to the daily calibrations that they have to do on all the equipment.
And then they're going to be compiling that into an Excel file and weekly and review it monthly. And then all of the lab reports will be reviewed monthly to ensure all the information that the state requires is included in the report and that all reports meet state regulations. Laundry has reported they're still having problems with stains on ER laundry as a result of chloroprep inhibiclins. They've asked nursing staff to place disposable drape or linen on top of the sheet to avoid the stain. Stacy, I believe Krista also, they're looking into solutions that can handle the stain from the from these products. They had a metal door frame that was cracked and rusted, but it has been repaired and painted. They have paint on the floor coming off. It was removed from the dirty laundry room, but it's still present in the main laundry room, and it's slowly being removed when time is available. Materials management, the floor and central supply continues to have bubbling and crackling in the tiles. The damaged tiles were taken out, and cement compound was applied to even out the floor. So when it happens, Steve Ladd uses the cement to even out the floor. Dietary, there was paint on the wall by the dishwashing area that was chipping off. They reported to me at the time that they were waiting to get a new dishwasher and then a new backsplash would be installed. But we since have then gotten a new dishwasher. Did they
I
put
think
it?
all that, yes, we corrected all of that.
So that's all
yes.
corrected, okay, and the coffee machine wasn't heated, but they got that taken care of. So they're doing good in there. Maintenance, the fire marshal found a piece of lint on one of the sprinkler heads, so a monthly cleaning schedule has been set up to monitor sprinkler head cleaning.
How exactly does lint get on a sprinkler head?
I have no idea,
That's a
but
good
it was
question.
one of the things that came up approximately 18 months ago during a federal fire marshal inspection of the hospital somewhere. There was a piece of lint on one of those. They actually, I didn't see it, but one of our fire marshal inspectors claimed to see lint on one of our sprinkler heads, I believe, down here. And so once a month we go around with a can of air like you clean your keyboard with, and we spray off every one of these sprinkler heads. That was part of our plan of correction. Just like any other federal inspection, they will find something to cite you.
I was in the propane business once a while back, and first thing you learn in the propane business, when the fire marshal comes by, you make sure he sees something.
Something little.
Because I guarantee you, he's gonna find something somewhere.
Right.
So you wanna make sure he's in the right area to find something. Just
We can only do so
the
much
way you do
maneuvering.
it,
Our last fire marshal inspection, they made all the ladies in this place very mad because we had to take out all the space heaters that were under the desks and providing warmth. Because this was a fire marshal inspection in the dead of winter.
Yeah,
So, yeah, they'll always find something to irritate somebody.
yeah.
I'm sorry to interrupt, Nancy. I
It's
couldn't
all right.
help it.
It's all right. The walls continue to receive damage from beds and chairs being pushed up against them. Nursing and housekeeping has been informed to be more careful when moving furniture, and maintenance is looking into something to put on the heads of the beds, like a bumper pad, so the bed can't hit the wall. We've got a sample of a bumper pad. We're looking into maybe putting something on the back of those beds so that they don't hit the wall. Floor tiles continue to come loose and they're replaced as needed, and a grant will be applied for to remedy the problem. And the last page is our sleep study QA/QI that we just recently started doing the third quarter of 2018. The third quarter we had 3 sleep studies. Our average referral satisfaction score was 5, which was our goal. And our average turnaround time in days from when they had the study to when the report gets to the clinic was, our goal was 4 days, and it was actually 1 day, so that was really good. The fourth quarter of 2018, we had 2 sleep studies. Average referral satisfaction score was 5, which was our goal. Average turnaround time was 3 days, so that still beats our goal of 4.
Is there any questions from the board before this first on the QA? Thank you.
Mr. Chairman, think we need a motion now.
Right.
I hereby move to go into executive session for
5 minutes.
5 minutes to discuss the quarterly risk management report as authorized by section 75-4319, subsection B, subsection 5, Kansas Open Meeting Act, for patient confidentiality purpose, with Steve Janzel, Tanya Sykes, and Nancy Carter present. The meeting will reconvene in this meeting room.
Let's set that time to go into executive session in 2 minutes from now, and for 5 minutes. Reconvene at 12 minutes past the hour.
8:48.